Welcome to the Stellalife Innovator series. I'm Liz Lundry, and today I'm speaking with hygienist and activist Shavonne Healy. Shavonne is a leading advocate for dental hygienists with more than 20 years of clinical experience, and she's also the founder of A Higher Learning LLC. She's a leader and educator with expertise in preventative and non-surgical treatment of periodontal and peri-implant disease. Her international presentations have inspired clinicians, alumni, and faculty worldwide. And we're so happy to have you here today. So welcome, Shavonne. Thanks for joining us.
Thank you so much, Liz. It's really an honor to be here. Thank you.
Oh, I'm so pleased that you have some time for us because I know how busy you are. And, you are a true innovator, really elevating the dental hygiene profession as a clinician, as an educator, writer, and a researcher, and your involvement in the American Dental Hygienists Association as well. So with all these many things you do, what is the mission that's closest to your heart?
The mission that's closest to my heart. Well, it begins like this. To me, I think dental hygienists are really the key to creating a healthier society. We are the people or the healthcare professionals that patients see the most when they come into a dental health setting. Dental hygienists, we have many different responsibilities, but I think that we as educators is our first and foremost responsibility. So we have the knowledge and the skill to make a real difference in the lives of our patient through oral health education, oral health instruction, and nutritional counseling. Very simple things. And so that passion to want to help somebody is what drives me. So I believe that we're all here to serve a purpose, and that is to, whatever your gifts are, to contribute to your society to make this a better place. So fortunately, I have landed in the profession of dental hygiene, and so that is how I exercise my gift and how I contribute to hopefully like the global impact of the world. You asked about what is the mission that is closest to my heart. And that is for dental hygienists to finally be able to own our profession and practice to the full scope and potential of our license. Because again, we are the key to creating healthier societies.
Yeah, absolutely. And then the relationships that we have with our patients, the trust they have with us. I talk to friends of mine and they'll say, oh, I saw my dental hygienist and she said this, so we do have a very, strong impact based on those relationships. And as you said, we see them more often than they see the doctors, their dentists, certainly their physicians, unless they're being treated for something. So we can be lifestyle coaches for them and influence them over time for, a happier and healthier life. So as a change agent, how have you influenced your dental hygiene community as well as your patient community with social justice issues?
So, these are great questions, Liz. The challenge is that they're loaded questions.
I know.
Because we know about the different roles of not just dental hygienists, but healthcare professionals. And so if we really want to make an impact, you kind of have to have your hands in a little bit of everything, kind of like I do and like how you do. But so as healthcare professionals, I believe that our first priority is to advocate for the betterment of society, ultimately a better America, and then hopefully a better world. And I do that everywhere I go. I will talk to anybody who is interested. So that includes when I'm in line at the coffee shop, I struck up a conversation with a person of the public, right? Somebody who could be my patient. I've done it sitting in airports while waiting for flights, or just simply talking to somebody who's sitting next to me on a flight. The patient community is everywhere. And so isn't the opportunity to educate the public on these issues, like access to care. And these are patients who typically, or people that I've had conversations with that typically have access to care. They go to see their oral health care provider regularly, but they aren't aware of the bigger picture. They aren't aware of some of the access issues that we're having and how it affects your very community that you live in. So quality oral health care is a human right. And I believe, and that's how I try to express it to other dental hygienists and when I'm talking to my patients as well. I believe that everybody should have access to quality healthcare despite the socioeconomic status, especially children, because children cannot control the circumstances that they're born into. So through my continuing professional education business, a higher learning that I founded in 2021, we really aim to inspire dental hygienists to consider or reconsider a path into public health. Public health is the sector with the most need and the largest burden of healthcare worker shortages. So with access to quality dental hygiene care and education, these diseases that cause tooth loss and ultimately can decrease the quality of our patients' life, like tooth decay, disease, and even some oral cancers, they're highly preventable. So the endpoint goal of everything that I do and everything that I disseminate through my business really is to unify dental hygienists to become leaders in the movement for healthcare reform. But still, first, we must educate each other on our social responsibility. And I'm reminded of a quote by Aristotle when he said, educating the mind without educating the heart is no education at all. So once we are able to reconnect with the purpose of the dental hygiene profession, that's how we will birth more health justice advocates. So we will start to see changes in how dental hygiene care is delivered to the public, and then ultimately by addressing and spreading awareness about some of these social justice issues and becoming a part of the movement of change, we'll start to see that trickle down into the public and how it benefits overall health outcomes.
Yeah, absolutely. And it's there are so many things that we need to reform, definitely in healthcare. It's a crisis with a shortage of nurses and many other healthcare providers since the pandemic. So we have these things working against us. But as hygienists, absolutely working and looking at the greater public, keeping that in mind. We influence people. I also do the same thing, just talking to strangers when I'm out and about, and have had so many wonderful moments of, maybe brightening up someone's day, bringing a smile to their face, or sharing an interesting conversation. But that's how we spread our word, the word of reform, which not only, for me, I would love to see equitable education for everybody in the US. And I think that's a right. And I think we have a long way to go with that. And then healthcare and all of that follows. And we each have a role to play in that and should embrace that. So as we look at the big picture, we are really we're trying to make the world a better place, not just with optimal care for our patients, but influencing our communities. So, I don't know if you have any other advice for doctors and practices who would like to do more, in their communities to help patients get access, and having hygienists have the opportunity to practice in different environments, we're able to reach more people. So do you have anything else that you could advise us to do as we embark on this really tremendously, maybe challenging, but beautifully rewarding journey?
I was going to say rewarding. It doesn't matter if you are, a faculty member, in a dental hygiene program, a dentist in private practice, if you're working for an insurance company. All stakeholders involved in oral health have to play a role.
Yeah.
And something that we have to do is that we have to start having conversations with policymakers, because despite your setting, private practice or public health, the issues or the barriers can be connected to legislation.
Yeah.
And most importantly, outdated legislation that is no longer supported by, I don't know if it was supported by data or science, but healthcare professionals, we have to recognize the systemic issues, the policies that have created the circumstances that we are in today. I think a lot of people shy away from politics, but really it's a conversation about ethics and law, and how your moral beliefs or your ethics as a policymaker influence the laws that you enact or vote for. So healthcare professionals, especially in dentistry, whatever your mission is, because in the end, we all want to serve the community, but we do it in different ways. We have to start getting involved in politics and understanding how we are all connected, and how these different very complex conversations that are happening on the political from a political standpoint, how they affect us, not just as healthcare providers, but as just regular everyday people. But that's where I see that we've lacked the most representation is in politics, whether it's a local, state, or federal level. But that is part of spreading awareness to the community and understanding and helping them understand why it's important for you to get involved and become this political animal, as another hygienist, Christy Minaj Bernie, once said to me. But then also being able to provide them with the tools to do that if you choose to become a larger voice in your community. So, I wish I had a simple answer, but the challenge is that it's very complex. We have areas for opportunities, in every circumstance that you can think of as it affects our profession and the kind of care that our communities are being provided with.
Yeah, absolutely. So everybody taking a little bit of action will make a great result if we can really have that unity. And there are so many amazing leaders in dentistry that really have the DNA, as it were, to be leaders and to organize. So yes, if we can get more involved politically, we could go a long way to making some amazing changes in our communities in the US and in the whole world. So
yes, we just have to stop working so hard to pick our heads up and pay attention. And that's kind of what happened to me in 2020 during the pandemic with all that downtime. I was able to finally look up and say, this is what has been going on. Where have I been? Well, I've been working so hard. So with this work also comes lots of sacrifices too. But I think the key word that you said earlier was beautifully rewarding.
Yes. Yeah, absolutely. That satisfaction and knowing how you've impacted so many people, by doing this and helping lead the way. So Shavonne, thank you so much for sharing this with us. I think it's a great topic. We haven't really talked about this in these interviews, and I think all of us have some role to play in this, and we have a wonderful opportunity. So again, thank you for everything that you're doing and for sharing what you know with us and what you're doing. And everybody, we can hear Shavonne, a Higher Learning LLC is your company, and then you lecture and speak on these different topics. So please look out for Shavonne and come see her when you can. And everybody, thank you for joining us today on the Innovator series, and look forward to seeing you next time when we have another great conversation with an amazing individual like Shavonne. So Shavonne, thank you again for your time today. Really appreciate you.
Liz, thank you for the opportunity to provide some or give some awareness on these topics.
Great.
Appreciate it.
Thank you all. Everybody stay well, stay safe, and we'll see you next time. Thanks.